Open innovation is when two or more parties come together to create a product or a vision that is greater than any one organization could achieve on its own. The biggest contributions that startups can provide to the health service executive are innovation and agility. There's so many bright people with so many great ideas, and using agile approaches, they're able to iterate their products or solutions quickly to actually really meet real needs in the health market today. The most important open innovation activities within the HSE are those interactions with our ecosystem, and we have a vibrant digital health ecosystem in Ireland comprising of more than 100 digital health startups. We also have established tech players, we also have established pharmas. We're working very closely with the universities and policymakers, as well as, very importantly, patients and users. The way we orchestrate our digital health ecosystem is using a forum we call a Digital Academy Forum, which meets once a quarter. And here we share, spread, and solutionize new ideas that can be disruptive and can transform our ecosystem. We call our overarching digital innovation strategy Stay Left, Shift Left. Stay Left is about keeping people well in their homes, or if you happen to have a chronic condition, that you can be managed best of all from home or self-managed best from home. Shift Left is about finding solutions that move people as quickly as possible from an acute setting to a community setting to a home setting. And what we have found is this Stay Left, Shift Left has become a guiding vision for our ecosystem. So we have startups as well as established providers coming to us with solutions that actually meet the whole intention of Stay Left, Shift Left. When we see a digital technology intervention, we're looking for 4 characteristics in Stay Left, Shift Left. We're looking for something that will improve the cost of care or reduce the cost of care, improve quality of life, improve quality of care, and also improve the clinician experience. And very often we are finding, particularly startups who are nimble and agile, are able to come to us with propositions that really meet the intent of Stay Left, Shift Left. Now, the way we measure our open innovation activity and success is through our innovation pipeline and funnel. We have 4 phases in our innovation pipeline: exploration, pilot or proof of concept, demonstrator, and broad adoption. And as an example, currently we have about 25 solutions currently under exploration. We have 12 in pilot, 5 or 6 in demonstrator, and we had 7 solutions fully adopted this year, particularly in response to the COVID-19 period. And we also look at the agility, how fast it takes us to actually get a solution from idea to full solution. In the case of our remote monitoring for COVID-19, we went from an idea to a solution that was proliferated in just over 5 weeks to many of the major hospitals across the country. And this allowed people who had mild or moderate symptoms of COVID to be monitored from home. Probably the main barrier to the adoption of open innovation in the healthcare industry is culture. Eric Topol, a famed cardiologist, he says that medicine is remarkably resistant to change. And indeed, the system is designed not to change, because what you want to be able to do is eliminate variability. But the conditions you need for open innovation are different. You need to be able to have experiment and to be able to experiment and to move quickly. So the way we overcome the barriers is by using rapid solution prototyping and giving people a glimpse of what might be possible. And when that solution is so compelling, then the barriers to adoption drop away. Now, some of the tech areas that we're particularly bullish about, we're bullish about artificial intelligence. There is going to be a lot of data science as well, contributing big data, and that big data will be ideal to use for machine learning. One solution that we're working on is AI for diabetic retinal screening. And what we're seeing is that a 3-day process can be reduced to 10 days or 10 seconds. Another solution that we're bullish about is autonomous ultraviolet cleaning. We're testing a robot called Violet in one of our hospitals in the Midlands, and this is reducing the cleaning time for radiology rooms by two-thirds, and is proven technology to eliminate COVID. We're also experimenting with drones, and in more and more in Ireland, we have a living lab that is focused on delivery of medicine by drone. And lastly, I'd like to thank the organisers, Mind and Bridge and ICC. We're delighted to have this recognition and really appreciate it.